Welcome to Process Mapping for Public Health. My name is Juliana McMillan-Wilhoit, and I'm with Flourish Thrive Labs. I'm our Chief Operating Officer and our Chief Product Officer. And I'm really thankful that you're here today for us to talk about what process mapping can mean for you in your work in a health department. I'm now going to hand it over to my colleague Nebu for him to introduce himself.
Thanks, Juliana. My name is Nebu Kolencherry. Hi, everybody. I'm the Chief Revenue Officer here at Flourish Thrive Labs. We are a public health consulting firm that works with state and local health departments, just like yourselves, all over the country. And we are very proud to be one of NNPHI's TA partners for the FIG grant. This work is supported by the FIG grant through the CDC, which offers TA to health departments just like yourselves. So let's talk about what we'll be covering today. We're going to start with the basics. So what process mapping actually is and why it's worth your time. Process mapping, as you'll see, is valuable for quality improvement, for onboarding new staff, business continuity, and ultimately also for thinking about where automation or AI might fit into your workflows. We will then show you how we have applied this process with the health department in Sauk County, Wisconsin. And then Juliana will walk you through how to actually do the process mapping process, if you will. And before we wrap up, we'll give you a framework to figure out how to start in your organization, because honestly, the hardest part of this isn't to learn or go through the training. It's starting with that white piece of paper and knowing which process to tackle first. We'll also give you tools, process mapping guide, and a template that you can bring back to your team to get started. So let's jump right in. What is process mapping? At its simplest, a process map is a visual diagram that shows every step in a workflow. So who does what, in what order, and what decision gets made along the way. Really, that's it. Now, here's the thing about that definition. It sounds very simple, and the mechanics actually are quite simple, but the hard part isn't really drawing the map. The hard part is getting everyone in the room to agree on what the process actually is. Because in most organizations, and some of you may recognize this, if you ask 3 people how something gets done, you'll get 3 different answers. And usually all 3 of them are right. They're just sort of describing different versions of the same process. And that's actually one of the most valuable things that process mapping does. It surfaces those differences and it makes really sort of the invisible visible. Now, you'll hear a lot of different kinds of names for this work. So they may be called process maps, flow charts, workflow diagrams, swim lane diagrams, standard operating procedures, business process diagrams. So these terms get used interchangeably depending on who you're talking to, how they're trained, and really what sector they come from. For our purposes today, we're going to use process map as the umbrella term, and we'll show you what one actually looks like in a few minutes. One framing I find really useful is that to think of a process map as getting workflows out of people's heads and onto paper. So right now, I imagine a lot of how your public health agency works lives in the institutional memory of very specific staff members. So what happens when those people are out or sick or promoted or win the lottery? That knowledge walks out the door with them, and that's a huge liability for our organizations. A process map is one way to protect against that. So here's why it matters. Process mapping is genuinely useful for your organization today, right now, in a lot of different ways. So let's walk through 5 use cases, because I think at least 1 or 2 of them are going to hit home for you and for where your department is right now. The first is quality improvement. So if you've ever sat in a meeting where everyone agrees something isn't working, but nobody can agree quite why, that's usually a process problem. So when you map a workflow, you almost always find one step or many that are redundant handoffs that can get dropped, or places where the process depends on one person doing something a certain way that no one else knows about. And really, you can't fix what you can't see, and a process map is a good way to surface that. Another place it could be useful is onboarding. So think about the last time you brought a new staff member on, or you joined a new organization or new team. How did they learn, or how did you learn how things actually get done? Usually the answer is they shadowed someone, asked a lot of questions, and figured it out over time. A process map can accelerate that process. It can give new staff at least a framework of how work flows so that it can better tailor their questions and really improve their onboarding time. So it's not just what a giant policy manual says, but what actually happens. The third is accreditation. So for those of you working toward BAB accreditation or already accredited and are seeking reaccreditation, you know how documenting your processes in your department is a significant part of that work. Process maps are actually exactly the kind of evidence that supports those standards. They're especially useful for cross-jurisdictional or cross-team sharing agreements where you need to know that processes are standardized and transferable. Another area could be succession planning, which is of huge interest. Business continuity became very real for a lot of health departments during COVID. So, what happens when your key person is out, or what happens during a surge or a transition in leadership or a reorganization. If your workflows only exist in someone's head, then you're, one resignation away from a huge gap. And process mapping could be a tool to build your organizational resilience. And finally, readiness for AI and automation. Our opinion is that you can responsibly automate a process that you haven't documented. AI works best on workflows that are stable, well-defined, and understood. And process mapping is step one. So regardless of where AI fits into your organization's priorities right now, whether you have a policy, whether IT has given you the green light, or if you're just figuring it out on your own, the work that we're doing today has value for reasons that has nothing to do with AI. So through line across all 5 of these is the same. Process mapping can make the invisible visible. It takes knowledge that lives in people's heads and turns it into something that your whole organization can see, use, and build on. I also want to talk about work. For me, one of the most valuable things that process mapping does is not in the process map, but it's really philosophical, and it's about how your team thinks about work. In most organizations, when something needs to get done, the first question often is who handles that? And the answer is usually a name. Sarah handles intake. Mike knows how to do that report. Ask Janet. She's been here the longest. Now, that's not a system, that's a dependency, and it's quite fragile. Process mapping can be a way to shift that mindset. So instead of asking who's responsible for this, maybe your team can start asking what's the workflow? What are the steps? The work stops being something that belongs to a person because it's something that the whole team or whole organization owns. It's a series of steps that anyone with the right training can follow. And that shift in mindset has real benefits. It can make onboarding faster because new staff can see how workflows operate, not just shadow someone. It can make coverage easier because the process doesn't disappear when someone has to take a couple of days off. And hopefully it can redistribute the workload more equitably so that you're not relying on your most experienced people to carry on everything with the work that's in their heads. And now I want to say that the goal here isn't to make people replaceable. It's really to make sure that you have a resilient team that is operating in a healthy manner, and process mapping can be one way for you all to get there. Now, before we move on, I want to give you a moment to think about this. So go ahead and pause the training recording and ask yourself, where in your organization is work living in someone's head instead of on paper? It could be a specific program, a team, or a process that only one person really knows end to end. And don't limit yourself to the 5 areas that we just talked about. This could be anything. It could be an intake process, a reporting workflow, how your team handles a certain type of request. If there's a process in your organization where the answer to how does this work is, ask so-and-so, that's your candidate. So write it down, keep it in mind, because when we get to the hands-on part of this session, you're going to want a real workflow to think about, something that really matters to your team. So take a minute and then come back and we'll get into the how.
Thank you so much, Nebu. I really appreciate that insight that you gave us. And I really want to encourage everyone, if you didn't take a moment to pause, to think, and to reflect, I really want you to do that, to be able to have the idea of that process in your mind as we move forward. That's going to make this whole process so much easier, and it's going to mean that you will get more out of this training. But now I want us to actually look at, what does this look like in practice? What does this actually mean for you working in a health department? So I want to share an example of Sauk County, Wisconsin, a local health department that we partnered with on exactly this kind of challenge. Public Health Sauk County serves around 60,000 people. They're the water park capital of America. They have a gigantic footprint of restaurants, campsites, pools that they have to investigate, that they are responsible for. and their environmental health team was drowning in emails and documentation. Restaurant owners, food truck operators, catering businesses, all sending questions that required their staff to look up specific sections of the food code and respond with particular citations. They were asking things like, what temperature do I need to hold hot food at? Do I need a separate hand washing sink? How do I label my packaged goods? And they wanted to see if AI could help their team work more efficiently. None of the questions that they were being asked were particularly complicated. All of them had answers that were right in the food code. But the food code is a telephone book, if that makes any sense. It's something that is hundreds of pages long, something that is actually spread across multiple documents with both the food code and guidance documents. And it required their staff to pull the right section, write a reply, and it was eating up hours every single week. Time that could have been spent on inspections, proactive outreach, or higher complexity work. And we understand that most small to medium health departments spend about one full-time employee worth of time on similar tasks every single week. So what made this a great process mapping candidate? A few things. First, it was something that was repetitive. The same types of questions were coming in over and over and over again. It was something that was really well defined. There was a clear start and there was a clear end and a predictable set of steps in between. And it was painful enough that the team was genuinely motivated to do something about it. That pain is something that is really important. So the first thing that we did wasn't to build a solution. The first thing that we did was to map their process. We sat down with the environmental health team and walked through exactly what happens from the moment that an email comes in to the moment that a response comes out. And that map became the foundation for everything that came next. We began with mapping their current state process, and this is what Public Health Sauk County's environmental team's inspection process looked like. Let's walk through it. It starts on the left. An application is received or an applicant has questions or a community member has questions. From there, it gets assigned to a team member, but immediately there's a decision point. Does this require research? If no, the staff moves straight into a site inspection or responding to the question. If yes, they first have to go research the information, the food code, and guidance documents before they can go and do anything else. From the inspection or response, there's another key decision. Were there violations? If yes, the team identifies violations and corrective actions, issues corrective orders, and it potentially triggers a re-inspection. If it's unclear, staff have to stop and review the food code and guidance again before they can proceed. And eventually, everything flows into issuing a final communication or report. As you can see, Process Maps uses a visual language that's actually pretty simple once you know it. We'll go into more detail on these later in the session, but here's a quick overview. Rectangles are the steps. Anytime you see a box, it means that someone is doing something. An action is happening. Assign something to a team member, research site information, issue the final report. Those are all steps, sequential steps. Diamonds are decisions. Anytime you see a diamond, it means that a process has hit a fork in a road, a question that determines what happens next. In this map, you can see examples like requires research or violation with yes and no paths coming from them. Circles represent the starting event and the end of the process, and arrows show the direction of the flow and what comes after what. Again, we'll go into more detail on these later in the session. We also have additional materials that you can look at if that would be helpful for you as you're viewing this presentation. Step 2, identifying opportunities to use AI. Now let's look at where you can see all of those yellow sticky notes. Those are places where a food code AI tool could come in and support the work. It could provide site information, helping to interpret the food code, drafting corrective order communications with the right citations already included, or of an inspection report. What we didn't do was start by saying that we needed an AI tool. We didn't start by building the tool. We didn't start by implementing Public Health 360 with them. What we did is we mapped the process first and then looked to see where could AI augment the process. Because until you can see every step, every decision, every place where staff have to stop and look something up, you can't really begin to see where augmented intelligence, where automation would actually be able to make any sort of difference. But I also want you to notice something else. The map revealed where work required manual effort. The research step, unclear violations, the code review, those are all friction places. These are places where time gets eaten up, where consistency breaks down, where a newer staff member might make a different call from a veteran. The map makes all of those friction points very visible. So everything we've talked about thus far is about mapping your current state and how things actually work. That's the foundation, but it's not the end goal. The goal is to move you forward as an organization. Once you have a clear picture of your current workflow, you can start asking better questions. Where are the bottlenecks? Which steps add value? Which ones are just, we've always done it that way? You can begin to imagine another future, both a future where you have AI, but also just rethinking about if instead of things going to Bob, Larry, and Sue, what if it just went from Bob to Sue and cut Larry out of the mix? You can't skip the first step. You can't improve a process that you haven't documented. And the current state map is what makes the future state so possible. So again, going back to this example with Sauk County, once we mapped their process, we could actually evaluate where a tool might be helpful and could add to their workflow. And what the map showed us was very clear. The biggest friction points were all centered around the same thing, having to stop what they were doing, dig through hundreds of pages of the food code, find the right citation, and then translate that into a response. So then the next step was evaluating, how can we make that better? Well, we can't just stop citing the food code. That wasn't an option. So how can we help them come up with better responses and reduce those friction points? After reviewing all of their options, Sauk County selected PH360 or Public Health 360 as their platform. And we got to work building a custom chatbot on top of it. It was a tool that they were then able to use that was in compliance with their AI policies and allowed them to be able to upload documentation and then be able to get cited responses back. Everything that they needed that came out of that process map, PH360 was then able to work seamlessly within that process. In a test of a tool, they got remarkable results. It was reported that 83% of the time it reduced their workload. That was an amazing impact. It would take them 30 minutes to look up information, and we were able to cut that down to minutes by implementing PH360. It was able to maintain complete audit trails for transparency and also for public records requests. Because the team had been part of building the process map, there was actually a lot of team buy-in because they understood that this was a tool that was going to help them and that was configured specifically to help resolve some of the issues and challenges that they were having. They saw themselves in the solution. So how exactly do we go about mapping a process? Well, let's talk about it. So I'm a visual learner, so I think that one of the best ways that we can do this is actually thinking about a process map in action. And because everyone's health departments and every jurisdiction is going to be a little bit different, right? Going through a public health workflow might be a little bit different because everyone's going to be doing different work. Let's go through an example that at least is very prevalent in my life. And that's making a peanut butter and jelly sandwich for my child. So, right, let's get our thinking hats on and think about making this peanut butter and jelly sandwich. So we're going to build this map together piece by piece, starting with the foundation. I invite you, if you want, to just grab a piece of paper. You can use the PowerPoint that we have provided if you want to follow along and make a process map with us. For this example, we are making a peanut butter and jelly sandwich. And so the first thing that we want to do is we're starting with identifying who the individuals are. This is one of the most important things, is identifying who is involved in the process, right? And we represent each of those as being in their own unique swim lanes. So in this example, we have the child who is requesting the sandwich and the parent who is making the sandwich. This really, really matters to begin to lay out who is involved before you start mapping, right? If you think about making process mapping something that's collaborative, if you begin to lay out who you believe is involved in the process, you can then make sure that everyone is involved in the process of process mapping. So in our Sauk County example, you'll notice that we did not have swim lanes, and that's because the entire process was handled by one type of person, which was an environmental health inspector, right? So that things went into a joint inbox and then were responded to from there. So we didn't have those swim lanes because it was all, the same role of individuals. So that is really important, is to make sure that you're getting your foundation set by identifying who your people are. So then we need to begin to look at, how does the process start and how does the process end, right? We begin to define our boundaries. So this is really one of the most important parts and one of the most challenging. For our sandwich example, the start event is pretty simple. We would say my toddler comes up and says that they want a sandwich. That's the trigger. That's the thing that kicks off this entire process. That's what sets it off in motion. A key thing to note is that the start and ends are choices. You get to make a determination about when a process starts and when a process ends. So is the end event when my daughter takes her first bite of the sandwich, when she finishes the sandwich, when we walk over to the table and she decides if she is going to actually eat the sandwich that we've made, right? There's all different outcomes that can come from that. And so defining what those start and end points are is really important and something that is subjective, right? If we think about that within a public health context, it's a difference between a report being submitted and a report being reviewed and then acted on, or a referral sent and client connected to services. Your end event defines what success actually is. If you define it too early, you might be mapping an incomplete process, but if you define it too late, you may be doing work past the point where the process mapping is actually useful. So this becomes a judgment call and something that you need your team to align on. And as you get more experience with process mapping and using it within evaluation, we found that you get a lot better at defining that end. Right, at F&T Labs, one thing that we did is we mapped all of the processes for a medium-sized city as part of their insurance needs. And what we found was, the first map that we did with the department, there was a lot more sort of ambiguity and difficulty in terms of defining those start and end points. But once we got to like the 15th process with a particular department, they were a lot better at defining what their sort of definition of done was and what that endpoint is. For this scenario that we're going to be walking through, we're just going to define it as Mike has eaten the entirety of the sandwich. That's how we're defining it here. But, as you think about process mapping, write down your start and your end, and then begin to show them to your team. We encourage you to do this collaboratively and make sure that everyone agrees on that start and end. Now we have the fun opportunity of filling in the steps, the activities, right? These are our rectangle boxes. Each one represents a single action taken by a specific person. The key thing to remember here is that they start with a verb. So for example, in the parent lane, first, you'd gather the ingredients, then you'd make the sandwich, then you'd put the sandwich on a plate, you'd give the plate to the child who would sit at the table and eat the sandwich to end the process. Notice a few things. Each activity has one verb and one outcome. Gather ingredients, not gather ingredients and check the pantry and open the fridge and pour the milk. One step, one box. If you find yourself using the word and, it generally means that that's another action and should go in its own next activity box. The other thing that's important here is that the lane tells you who has ownership and who is acting, who owns that step. When the work moves from one person to another, that's a handoff. And you show that by drawing a connecting arrow. In our sandwich example, the moment that I place the sandwich on the plate and my child picks it up to carry it to the table, right? That is the point where when my child is sitting at the table and I hand them the plate, they then become responsible for the process of eating the sandwich. Understanding that handoff is really important as you think about understanding your processes and process improvement. It's one of the most important things to capture on your map because handoffs are almost always where things get dropped, delayed, or where things get done inconsistently. Right? If you think about this within your work in a public health department, this is where a lot of hidden work gets surfaced. We can think about steps that everyone assumed someone else was doing, or tasks that fall between roles, or work that only happens because one specific person happens to know that it needs to happen. When you put the activities in lanes, the gaps begin to show up immediately, as well as all the labor that one person or one team may be doing that other people don't have insight into. Now, one question that we often get asked when we lead these workshops is about a level of detail. And so there are people who process map professionally, and they will talk about differing levels of process maps, P0, P1, P2, etc. And as the numbers go up, the level of detail goes up. And so you get to determine what level of detail is useful for you. So additional levels of detail would be, getting the bread, spreading the peanut butter, spreading the jelly. That level of detail can be really useful, if those orderings make sense. But what we have found is that in most contexts, as you're thinking about documenting a process, being able to create greater efficiencies as well as greater communication and for process improvement, that a higher level of detail where you are not focusing on every single small step, but you're focusing on the bigger steps works just fine. So that is just a word on the leveling. One thing though, that as we talk here that we've oftentimes found is that people will often forget to include technology in their activities. So sometimes when you process map and you want to include technology, you may just include that as like a separate box, or like you could include things in parentheses. But sometimes you actually want to include the technology like as its own swim lane. Because in many public health workflows, technology isn't something that's just like running in the background. It's an active part of how so many of these steps get done. If a staff member has to log into a system, enter the data, run the report through a particular platform, that's really, really important that that gets captured. In particular, if you're having to enter things into multiple platforms and the inefficiencies that could be caused there, as well as just creating the awareness of how these processes work in terms of having to enter things into multiple systems. So you might have an activity that says, enter case report into CDC surveillance system, or send a notification to the EHR, or, right, you may have an entire swim lane that is around your EHR or whatever the system is. It will depend a bit in terms of your organization, but taking that technology into account this is also important as you think about contingencies down the line, as well as thinking about making sure that your staff even have like the right permissions to systems, so that understanding what technology is involved as you think about your capacity planning, workforce planning, and all of that. Okay. So we talked about the activities, our rectangles. Now let's talk about our diamonds, which are our decision points. So these are moments in a process where a path splits depending on an answer to a question. So there's actually a first question that we could have, and this is one that happens way too often in my house, which is, do we actually have peanut butter and jelly? So then it's a yes, no, because if we don't have peanut butter and jelly, then, this process is very different. And so we then have two branching outcomes. So here we say, if we don't have it, I'm going to go to the store and I'm going to purchase the supplies for making the peanut butter and jelly. And, the other option is, and then that feeds into gathering the ingredients. You could have your end. You could have an end there where if no, we don't have it, then we're not going to continue on with this process. That is also an option, is that you could have multiple ends where you don't have the stuff for peanut butter and jelly, and so we are not going to continue here. But in many cases, the paths do converge back together, right? Where we procure the ingredients in some way, and then we converge back and we start working towards the same outcome. Also, decision points don't have to be a yes or no. They can actually be what we would call parallel activities. So steps that happen at the same time rather than things are happening sequentially. So where something happens and then, two things happen in parallel. So while I am getting all the ingredients together and actually making the sandwich, my child is going to actually do the parallel activity of getting her beverage, right? Going over to the fridge and getting a drink from the fridge. And so in process mapping world, we represent that with a diamond with a cross in it rather than an X, showing that these are things that are happening in parallel. This is something that is really important as you think about your processes, is recognizing that some things can happen in parallel. So if you think about your new employee onboarding process, so while HR is setting up the employee's system access and getting all their paperwork processed and all of that, likely a supervisor is also thinking about, okay, what is their orientation schedule, training materials, all of those things. Those are two things that are happening in parallel. But if your organization is currently doing those things in this sequence, like HR processes paperwork, and then once that's all processed, then the supervisor does the next part of things, that's an efficiency that you could see once you have your process map. Again, not all of this is necessarily about efficiency. It's just about understanding what the process is and see how can you better serve your staff and your community by understanding what it is. Parallel activities often represent some of the easiest wins in a process improvement. You're not eliminating steps, but you're just changing who does what. You're just running things at the same time, and so you don't have to wait on one step to finish before moving on to the other. Obviously, not every step can work in parallel, but sometimes they can, and that's something that's really helpful with the process mapping. So as we talked about a little bit ago, process mapping can get significantly more complex than what we've covered today. There's additional types of gateways, exception flows, error handling paths, sub-processes, so much more that is very cool. And if you are the type of person who loves nerding out on those things, that is amazing. We have a resource where you can read more about those things. But often, at least in our experience, and we have mapped a lot of processes over time. We mapped all of the key processes for a large municipal government, as well as working on this with lots of local health departments. We found that these basics cover 95% of the time, particularly if you're mapping at a higher level. So don't let all of the things sort of stand in your way. We think that this is a really, really good way and place to get started. Start simple, build your first process map. Don't get stuck in the weeds. We really want to encourage you on that. Okay, so we've covered a lot today. We've talked about how Sauk County did it, how they went from thinking about a process, mapping that process, and then making changes on that by implementing an AI solution through Public Health 360. We talked about the example of making a peanut butter and jelly sandwich. We talked about all the different notation, and we've started to look at this in practice. So now, how do you get started within your organization? Well, I want to leave you with some practical guidance. 5 things that are going to make your process mapping go significantly more smoothly. So the first thing is to get the right people in the room. We believe that process mapping is a collaborative exercise and something that needs to be done with multiple stakeholders. It can be a useful process for you to just do it on your own, but that's then living in your brain as opposed to letting other people weigh in on how the process works. So make it collaborative. Get some chips, get people together, have fun. But one of the most common mistakes that we've seen in our experience doing this is only getting the managers or directors in the room and not getting everyone present. Managers and directors often know how a process is supposed to work. They understand sort of it from the SOP way, as opposed to how the work actually gets done. That is very, very good knowledge to have. But if we want to actually recognize the reality of the situation, we need to get the people who are doing the work. So we believe, and the literature would support this, that every role that is involved with a process needs to be represented. So for example, if you have a process that involves community health workers, having a community health worker present is very important. You don't need to have all of your community health workers, but having one of them is something that's very important. Or if it's something where something goes to a data analyst, having a data analyst who's present. It's also very helpful if you have someone who facilitates the conversation who doesn't own the process. That just means that it's going to be a far more neutral facilitator and somebody who's able to just ask better questions, who is coming with less of a preconceived understanding and notion, and there's going to be neutrality. It's also important to designate someone to capture the map in real time. And it's really helpful if that's somebody who is other than the facilitator. So the facilitator can focus on asking the questions, and then somebody is there mapping, moving the shapes around. The second thing is you need to map your current state. Map what is, not what should be. This is really hard. In public health, we're taught to think about a future, a better future. We talk about strategic planning, and we think often about our future. You want to think about what is actually present today, not what's in the policy manual, not what's in the SOP. What is the lived reality of your staff, of the community members, whoever is involved with this process? You need to think about what are the workarounds? What are the dropped handoffs? What are some of the shadow IT of people, putting stuff into a Google Doc or whatever? That is really, really important to own up to what the process is. The gaps between your mental map of what it should be and the actual map, that's where the improvement can happen, but you need to actually map what it is. The next thing is to pick your tool and to not overthink it. Don't let a tool be an obstacle. For a live session, if you're meeting in person, often the best tool is a low-tech one. Sticky notes and a whiteboard where you can put things on sticky notes and just draw the arrows. We found that works best. For documenting and sharing afterwards, you can use PowerPoint. We have a PowerPoint template that you can use. If you want something that's a little bit more purpose-built, Lucidchart has a free tier that covers most of what you're going to need. There's Miro and Mural are great options, Microsoft Whiteboard, as well as Microsoft Visio, maybe something that your organization has, and that's like the industry standard and is going to work the best. But don't let the tech stand in the way of the good and important work that you want to do. The map doesn't have to be perfect. It doesn't have to look absolutely perfect for it to have meaning. Then our fourth thing is that you want to validate your map. So once you draft your map, don't assume that it's accurate just because of people who built it together. You need to validate it. So that means taking your map back to the people who do the work, especially if there was anyone who wasn't in the room, and walking through them step by step. Does it reflect what actually happens? Are things missing? Is anything wrong? They may be able to shed insight of a different way that things happen or steps getting skipped. And validation doesn't have to be like a super formal process, but it can be as simple as printing out the map and walking it over to a colleague and saying, hey, does this look right to you? Again, talk to them about what actually happens and not what should be. And then the final step is to keep your maps alive. Actually use it. A process map is not a one-time deliverable. It's a living document. So processes change, staff change, systems hopefully get updated. And so there should be some level of regular review that you have, even if it's just once a year, to go through your maps and to see if they still reflect the current reality. One thing about that is that it can be really helpful, instead of naming a person on a map, to name it as a team or a role. So instead of naming, like using your executive director's name or your health officer's name, just putting health officer. So that way it is it will be current if that person leaves their role. So let's start small and pick just one process. So we've covered a lot of ground today. What is process mapping, why it matters, how to build a map, and how to set yourself up for success. Process mapping isn't the methodology. It's about choosing that first process and getting over your fears and your inertia of getting started. Because once you start looking, you're also going to start seeing candidates everywhere. Every team has those workflows that live in someone's head. Every department has processes that only work because the right person knows what to do. And if they leave, like a lot of the public health workforce is doing, you're going to be in a rough spot. So here's a few questions for you to start thinking about. Where is the work dependent on just one person? Where if one person leaves, if somebody calls out sick, or if they didn't come back for 2 weeks, where would they fall apart? That could be a process worth mapping. Second question would be, where do things often get dropped or delayed? Are there some processes that you know that there's just some challenges with, and that it could add a lot of clarity by just understanding and getting clarity around what is the process? That could be a place to start. Third would be, where does your team spend time where it shouldn't have to? So think about repetitive work, answering the same questions over and over, doing manual steps that you feel like should be easier. Mapping that process. Again, don't come at it from knowing what your change that you want is, but let's start thinking about identifying what those processes is. Fourth would be, where do you not want to lose knowledge? Do you know of somebody who's retiring soon? A long tenured staff member who's moving to a new role? You've been given the heads up that one of your staff members is starting to look for new work? Do you have somebody who's going to be going on medical leave? Knowing if you have knowledge that somebody is going to be potentially leaving or away for a period of time, now would be a great chance to document that knowledge so that there's a smoother transition. Again, you don't have to map everything. We just encourage you to start by mapping one process. Pick the process where the answer to one of these questions is the loudest, and we encourage you to just start there. I just want you to take a moment and just pause and think, which of those really resonated with you? And is there one process that's coming to mind? I want you to write that down right now. Okay, so we've covered a lot today. Let's take a quick look at everything that we covered. We started with looking at the fundamentals. What is a process map? We looked at the vocabulary around it and why there is value beyond just one single use case. We looked at a real example of Sauk County, Wisconsin, and how mapping a workflow led to a solution through Public Health 360 that actually fit their problem. They didn't come in saying, we need AI necessarily. They looked at the problem and came up with an excellent solution in PH 360 that really fit their needs. And then we built a process map together from scratch, working through every element. We looked at the swim lanes, the start and the end, those circles, events, activities, decision points, and parallel activities. And we also talked about some of the practical side of things, who to involve, how to validate your map, what tools to use, and how to keep your maps alive. Now, we're almost done. So I had you pause a moment ago and think about that one activity. But I want you to pause again and just keep thinking here. And I want you to write down 3 things. So the first is I want you to write out the process that you want to map first. Write that down. The second thing is I want you to write down a date. I want you to write down a date that you think it would work to take your next action step. Yes, you're going to have to coordinate calendars, but let's think about a date. How far into the future do you want to do this? Think about a date that you can take your next step and write that down. And then the third thing is a person. Who is the one person that you need to have in the room to begin that process mapping? So that's three things: a process, a person, and a date. Everything else that we covered today will be there when you need it. Those are the three things that you need. So take a moment and write that down. Process, person, and date. Thank you so much for participating in this training today. I'm really grateful that you've taken the time to learn and invest in you and in your health department. You matter. Your work deeply matters. You are making an impact. For me, a Midwestern mom, I am personally thankful that there are people like you investing in America's public health infrastructure. So a few logistical things. There are 2 files that are included in this training that will be on the website. There's a process mapping guide, which includes everything we've covered today, as well as a facilitator's guide that will walk you through the process for a process mapping workshop and meeting. There's also a process mapping template, which is a PowerPoint template that's ready to go for you to use and for you to bring back to your team. You have everything that you need. Remember those 3 things: your process, your person, and your date. We are rooting for you and cheering for you. We are so thankful that you have taken this time today. You've got it. Thank you so much for everything that you do.